to Liverpool City Region Creating Careers. On today's episode, we're lucky enough to be joined by Danny from the NHS Liverpool's Women's Hospital. Hi Danny, thanks for joining us today.
Hi Jill, yes, so as Jill just said, my name's Danny and I am an operating department practitioner at Liverpool Women's. We usually get called ODP for short, but yeah, that's what it means, operating department practitioner.
Thanks Danny, and just before we start the session today, students, please make sure that you've completed the pre-work that's been set. If you haven't done it, please press pause, complete the work and then come back to us. So yeah, thanks Danny for joining us today. So yeah, let's get straight into the session. And do you want to tell us a little bit about yourself and how long you've been working at the Women's for?
Yeah, so obviously I am 47 years young, shall I say. I've been at the Women's for 13 years now. So quite a good length of time. Started obviously my training as an ODP, operating department practitioner. Previous to that, I was a fitness instructor for many years, and then decided I wanted to take that further and sort of have a more hands-on approach, looking after people maybe who needed extra care. And I think the operating theatres was something that sort of definitely triggered my interest, I think. So yeah, went along that road, went to Edge Hill. Was placed at Liverpool Women's for quite a bit of me training. Also did some training at the Royal Liverpool Hospital, Broad Green Hospital, Heart and Chest Hospital. So yeah, I had a sort of wide variety of the operating theatres really. And then once qualified, decided to take the job at Liverpool Women's because I wanted to specialise in obstetric and gynaecology surgery, which is what we do here at LWH.
Yeah, and I think we'll cover a little bit about what you do at Liverpool's Women's. So obviously we keep mentioning the ODP, which is the operating department practitioner. So tell us exactly what is the job and what do you actually do?
Okay, so being an ODP, operating department practitioner, what we do is we specialise. So we're highly trained specialists in the operating theatre environment. So where a nurse will sort of specialise in their 3 years across wards and different areas of nursing, we just focus on the operating theatre. So that's all that we do. And over those 3 years of training, we cover many sorts of specialities within the operating theatre. So for us, we've obviously got 3 roles that we do. And those 3 roles are what they call, so we do something called scrub, which is when we are probably your listeners would liken that to some maybe Holby City, where the surgeons and the scrub staff are standing around the patient, all gowned up, masks, gowns, all sterile, passing instruments to the surgeons, making sure the patient stays safe through the procedure. So that's the scrub aspect of the role that we do. We also then specialise during the anaesthetic phase, which is when a patient comes in, is put to sleep for their operation, and us as the ODP would manage that whole sort of process, making sure that the patient's kept warm, kept safe, pain is controlled, positioning, just that the patient's nice and secure. And then we have the recovery phase, so the recovery practitioner side of it, which is patient wakes up after their operation, comes through into the recovery room, and we look after that patient until they are fit to return to the ward. So until they are obviously not in pain or pain managed, comfortable, and not feeling sick, anything like that, and they're ready to go back to the ward. So there's basically 3 aspects to our role, and during our 3-year training program, we do all of those roles. So you learn them inside out. Once you qualify at the end of the 3 years, that is when our ODPs then decide what one they want to focus on. So, which is the one that they've enjoyed the most. And here at Liverpool Women's, we offer a dual role ODP role. So what that means is, so for myself personally, I will do anaesthetics and I'll do recovery. They'll be my 2 main skills while I work at Liverpool Women's, which is really good because, you do 3 roles. So you want to keep your skills up. I know some trusts will just offer the 1 role, which is fine. Everybody's different. Some people just want to do the 1 role, but for us here, we offer 2. Yeah. I think it's really good for keeping your skills up. So yeah, that's great for me. I do obviously anaesthetics and recovery. So it's quite nice because obviously you see the patient just before their operation, when they're at the most vulnerable, they're really anxious, and you sort of look after them. And then again, once they've had the procedure, to make sure that they're safe to return to the ward before they go home.
And you mentioned before, obviously, the work that you do at the Women's,
Mm-hmm.
and obviously some of the other hospitals around the region have different specialisms. So presumably the ODP role is the same. It's just the fact that you're working on different operations and procedures within the operating theatre.
Yeah, exactly. So like you said, you're exactly right, Jill. So our role as an ODP, so, you know, anaesthetics, so scrub, anaesthetics and recovery, they're all sort of parts to our role, and they all have sort of basics that we would learn. So every ODP would learn all of the basics in the 3 years, but then depending on which hospital you're in at the time or you choose to go to will depend on what speciality you follow. So yeah, you're right. So the operation will change. Drugs that are used may change. Position of the patient may change. And so I say for us, we're obviously obstetrics and gynae, so gynecology. So we're looking after obviously the pregnant ladies that are coming in to deliver their babies through cesarean section, and other sort of procedures that are associated with pregnancy. And then we've got gynecology, which is sort of ranging from, you know, just generally women's health. So, you know, basic sort of procedures, you know, hysteroscopies, looking inside the womb to see why patients are bleeding, and obviously then going on to some of your cancers. So, you know, things like obviously, you know, ovarian cancer, which is, you know, a sort of silent cancer really. Vulval cancer, we work a lot with vulval cancers, which is a cancer that not a lot of people know about. So it's involving obviously, you know, the vulval area. And so obviously we do hysterectomies. So, you know, that's sort of common to what we do. However, if I was working in the Royal, so as part of my training, I work quite a lot at the Royal. So the Royal will do, you know, vascular surgery. They'll do orthopedic surgery. So they work, you know, they're working on spinal, you know, spines, you know, hips, knees, shoulders. They'll do urology. We do some urogynae, we do some urology like procedures, but generally ours is sort of you know, gynae and obstetrics. So yeah, again, you know, the Royal, you might do breast surgery. You know, they do eyes, they do St. Paul, they do eyes. So they've got a vast sort of speciality there really. Then if you go to sort of heart and chest, which I did a placement there, theirs is obviously, again, you know, it's thoracic, it's about the lungs, it's about, you know, heart, so bypass, things like that. They've got a cath lab there, which the ODPs have quite a strong sort of input on the cath lab. I know there's been a lot of developments there with band sixes, ODPs working in the cath lab, which is basically, you know, a patient's potentially having a heart attack, you know, an MI. They get sent straight within that sort of 90-minute window to heart and chest, and they can practically reverse the effects of that heart attack. So it's absolutely phenomenal what we do.
Wow. Yeah.
You've obviously got you've got Walton Neuro, which obviously is, you know, neuro, it's head. Again, they do some spinal surgery there. So I mean, again, I think the role of the ODP, it's what's great is as part of your 3 years, because you do move from trust to trust and you go from theatres to theatres. By the end of your training, you know where you want to work, you know what you want to specialise in. I've not really sort of met anyone yet, any of our students, that don't know where they want to work at the end of the 3 years. So it's really good. And eventually, I suppose, you know, we're all doing our own thing, but ultimately we're all one big trust, aren't we, Liverpool? Because it's great that we've got hospitals so close together that all specialise in different areas. So particularly for the role of the ODP in theatres, you know, it's quite a great time at the moment. And I think with the COVID pandemic, obviously, because I mean, that's something that's really sort of at the forefront of everything we do at the moment. That sort of put ODPs into another light again, because we've been able to transfer our skills, go into intensive care units, high dependency units, and use our airway skills and our airway management skills. And so again, it's sort of developing that role of the ODP. And I think it's great because it's sort of the unknown role, because not a lot of people, unless you work in a hospital, and probably particularly you know, towards a theatre, or you have connections with the theatre department, you probably wouldn't know what an ODP is. So I think it's great that we've sort of, you know, come out to the forefront. And I think it's a role that I think, you know, especially for young people coming in, it gives them the option of, you know, you've got nursing, which we know is a really well established role, been around for, you know, how many years, Florence Nightingale, and so it's quite nice to give people a bit of an alternative, because obviously there's many careers in the NHS that people don't always know about. So I think it's really great to get this opportunity to talk about the role of the ODP, because, you know, we want to sort of keep developing it and keep pushing that role forward, really.
And that leads us quite nicely into, I suppose, one of the key things, like you've just mentioned, there is our students will know a lot about nursing, and we do quite a lot of focus on nursing. And that was obviously a really big, I suppose, highlight for us to actually be able to bring yourself onto this session today and talk about something that maybe they've not heard a lot about, that you can certainly study for. And we're gonna cover off what students can look for. I suppose, how does the nursing role differ to an ODP? And I suppose focusing on what kind of skills do you need, or what kind of skills do you think our students should be looking for and focusing on in terms of actually thinking about wanting to be an ODP?
So I think, like you say, so going back to obviously, so nurses, so particularly in theatres, so just in our theatres alone, we've got quite a good balance really between ODPs and theatres, nurses, sorry. So we've got, you know, some nurses that have obviously been, qualified for a long time, got their qualification, decided that they did a placement in theatre at some point throughout their 3 years and loved it and wanted to go into theatres. So they were able to sort of bring all the skills that they'd learned, so all your communication skills, you know, your people management skills, you know, patient care, attention to detail, all of those things carry through into theatres and obviously in the role of the ODP. So like I said, we've obviously got some ODPs and we've got nurses that work together. What's quite nice is that you've got that sort of differences between the two, but we come together as a team. So for a nurse coming through, so if any of your listeners are wanting to maybe go into the nursing side, they can still at some point end up in theatres. It doesn't mean because they go to be a nurse that they can't come into theatres. They can still, we welcome nurses to come into the operating theatre. And what they would do is they would do the qualification, 3 years training on the wards, and all the way they would normally do, and then they would come to us and they would then specialise in the scrub role usually. So they would be assisting the surgeon, preparing the instruments, handing instruments over during the surgery, making sure the patient's safe, making sure that everything's counted for and correct, so that obviously the patient gets the right procedure and nothing's left inside the patient, which, you know, has happened over the years in many hospitals, when there's not been stringent sort of health and safety in place like there is now. So yeah, so in terms of, so our nurses, you know, that's what they do predominantly. They come through, they learn the scrub role, and then they support sort of that phase of the patient's journey really. I say for us as the ODP, we obviously can specialise in all three. We can do all three if we like. We have got one member of staff currently on our department that does do all three. She's fantastic, one of our ODPs. And like I said, I think that the skills for me, you know, huge skills are, you know, probably in every walk of life, communication skills. Communication is so important in theatres because, you know, it can be quite a quick, you know, sort of, it can be somewhat stressful at times because, you know, we're looking after patients who are poorly. We've got patients who are anaesthetised, they can't speak for themselves. So literally our focus is to look after that patient and be their advocate really, and speak for them and make sure that we've got everything we need. So communication is definitely a vital skill. Attention to detail, you know, making sure that, you know, everything's precise and documentation is done. Being a team player is huge in theatres because obviously, again, you know, sometimes it could be 3 o'clock in the morning and there's only sort of maybe four of you in. You've got a patient on the table who's poorly, and so, you know, supporting your team and your colleagues is absolutely vital really. I think even more so now because of, you know, we're getting sicker patients through, and because of the pandemic we've got a backlog of patients that obviously, you know, are coming from different trusts, all parts of the country that need operations. So I think teamwork is probably one of the biggest things. You're a lone practitioner when you're on anaesthetic, so you work predominantly with the anaesthetist, but you rely heavily on your team, and I think that's something that that sort of draws the ODP students really. And once they sort of see that dynamic put together, they just grow from strength to strength, I think. And it's great to see our ODP students develop into ODPs and still work with us sort of how many years down the road. So it's great.
And I know in part 2 of this session, we're going to meet Laura, who's one of your apprentices, who's actually doing a degree in operating department practice. So it'll be great to hear from Laura. But just in terms of what Laura's doing, so can you just give us a little bit of information around that study programme that Laura's actually currently on? And I know, I think locally, I know that Edge Hill are obviously supporting that programme, and I think Laura's actually studying through Bolton University, so just be good to give our students a little bit of insight about what's available really in the region.
Yeah, that's fine, Jill. So obviously currently there's sort of 2 ways that our students can go through at the moment. So one of them, like you say, you mentioned, so there's Edge Hill. So Edge Hill's sort of quite local to us really, and what tends to happen there is we get direct entry students. So those students decide they go off on an open day, look around Edge Hill, and I must say the facilities in Edge Hill for ODPs are probably the best they've ever been. They've got a sort of state-of-the-art operating theatre set up, so it's literally, you can do simulation there. It's absolutely amazing. I've been invited there a few times to do some teaching sessions for the students, and it's absolutely phenomenal what they get. So what they do is they would go have an open day, decide they want to be an ODP, or if they know somebody who's an ODP already, they'll go get an interview, get accepted onto the course. That's then a 3-year course. They will spend probably 40% of the time in uni and 60% of the time sort of in a placement. So like us at Liverpool Women. So we have currently we've got 6 ODP students with us at the moment. Different years, so year 1, year 2 and year 3, and I say they will spend that time literally, it's on the job learning. So they're with their mentors 4 days a week. They're learning the job of the ODP, they're learning the skill set, so anaesthetics, scrub, recovery, so they're learning everything that goes with that, learning about drugs, pharmacology, how to look after a critically ill patient. There's so many things that they have to cover. And then as well as that, they have to spend some time in uni, which has obviously been a bit difficult over the last 12 months. So we've obviously come online like what we're doing now. So there's a lot of online going on, but they've adapted really well. So they will do that. And then obviously at the end, they will become a fully fledged operating department practitioner with their degree in operating department practice. So that's great. Then you've obviously got Bolton Uni, which you've come in, which myself and Anne Bridson have been heavily involved in. And that's where one of our own staff, who is Laura that we're talking about a bit before, so she was accepted onto the apprentice programme. So she met the criteria, which obviously she, did some maths and English, and she obviously previously had studied as like an assistant practitioner to develop her own skills. So she was accepted onto the programme. So she's now in year 3. And again, it's very sort of similar setup. So she will spend some time at Bolton Uni. A lot of it's been online, obviously, because of the pandemic. And then the rest of the time, she's basically on the job learning with us. So she is learning that role of the ODP. And then we also give her some sort of skills and things to do outside. So like off the job learning as well. So she might go to a different department. She might learn, she might go to pharmacy. She might go over the ward. It's about sort of broadening, and giving her as much of a learning opportunity as possible. So I say she's in year 3. She'll qualify in January, and then she'll be sort of fully fledged, ready to go. So she'll work with us as part of the team. And I think currently she's probably going to start on anaesthetics, which is definitely probably one of her strengths. I think she would agree. She's great at all 3, but definitely anaesthetics, I think, is what's driving her at the moment. She's getting a real sense of achievement out of doing that. So, it's a hard course in terms of, there's a lot to do. So, typically when you go to uni, you might, do lectures, and then obviously, you've got plenty of time to do that work with ODP, very similar to nursing. You've got work that you've expected to do, but as well, you are doing a full-time job. But, that learning that you're getting both sort of, clinically and sort of from uni, it completes the role really. So these guys are coming out and they're ready to go because they've got the skill set, they've got the knowledge, they've got the skill set. So for us, it's sort of, we see them develop over those 3 years. And for me, these are the people that are going to be looking after, all of our patients in the future. So we want them to be highly skilled, and we need them to, to have that focus and that drive. And that's what it gives them really, that 3 years, because it is hard work. but you know, they come out the other side, and Laura will be able to talk to you about that. You know, and the difference in Laura over these 3 years, and her confidence, you know, her communication, sort of her skill set and knowledge, what she knows now, you know, she will tell you herself, you know, it's invaluable to her learning, really.
Yeah.
So, you know, I think it's just a great way of being able to focus and put all your skills and come out the other side with a qualification.
And I'm presuming from what you're saying, Danny, currently that there's obviously capacity in terms of jobs, you know, because, you know, these roles are, you know, the specialism that you're developing, people that are actually on these either degree courses, apprenticeship courses, the qualifications that you're obviously going towards the end of that. And then obviously there's, you know, job availability for our students to be straight into a job and full time.
Yeah, absolutely. I can honestly say, I don't think I've not come across anybody yet that's not been employed at the end of their 3 years, and that's on both sides. So that's obviously on the direct entry students, and that's on the apprentice. You know, the apprentice obviously is a little bit different because they are already employed by the trust in a role, so they've already got a role, and then obviously, but then we will offer them the role of the ODP at the end of it. With a direct entry student, they're obviously coming in, they haven't got a job to begin with, but if they are showing that, you know, they're committed to that trust is where they want to work at the end of the 3 years. You know, their sickness, their you know, everything, their punctuality, if they are showing commitment to us, then we will be able to offer them a role at the end. And like I said, you know, up to now, we've not been able to offer anybody a role at the end. And that's the same in sort of all the trusts, really, because we all sort of communicate to the practice educators, like myself. We all sort of communicate with each other about students, and we sort of try and get students to have great opportunities. So I might send 2 of our students over to Heart and Chest, and they'll send 2 of their students to us. So we just sort of try and give them as much opportunities as we can for them also to be able to decide what speciality they want to work in when they qualify. You know, because selfishly, I'd like to probably keep all of our students here to myself, but we can't. We've got to let them have that opportunity, haven't we, to go and see what else is out there. And you know, some of them will go away and come back and say, do you know what, I went to Alder Hey and I loved it, and you know what, you know, you're gonna kill me for saying this, but I want to go and work in Alder Hey. And I'm like, do you know what, that's fine, because ultimately, you know, we want to make sure you end up in the right hospital at the end. You know, and that will happen where one of their students may come to us and fall in love with obstetrics and gynecology at Liverpool Women's and say, oh, I want to work here. So it all balances out, you know, in the end. And you know, I think, you know, for me, if I wouldn't have had the opportunities to go to those other hospitals, I would have always maybe been thinking, what if, you know, maybe would I have liked to work in, you know, Walton Neuro, or would have and I would never have known. So I think it's good for us to give them the opportunities. And I think with ODP, it's quite good that all the practice educators sort of in our region, we all go on meetings together. So we do try and swap students internally and give them, you know, so if a student comes to me and says, look, I really would like to go to Heart and Chest, and I'll say, right, that's okay, let's get you out there, and we'll do swaps sort of between the students. So that's something I think we're really keen on, and we've really tried to promote that because it helps with the role, and also it gets them in the right place. And, you know, and I want, you know, we want them to ultimately be happy where they are. And you know, and like I said, not everybody might want to come and work in Liverpool Women's because they might think, oh, obs and gynae, but once they come, you know, they sometimes fall in love with the place, and they say, you know, I don't want to leave. So I think, you know, we have perceptions of what a place is like till we come. And I say, no, for us, you know, obstetrics in itself is just one of the busiest units probably in the country, Liverpool Women. So the amount of patients we have through our doors, I mean, you know, our theatres are 24/7. So we literally cover, you know, 24/7 care, and we are probably busier than we've ever been. So, you know, the role of the ODP is only something that's becoming more and more wanted, really. And like I said, you know, theatre departments are branching out because, you know, they're taking on more operations. There's more consultants coming in, so there's only more opportunities for people to sort of come into the role of the ODP and end up with a really good job at the end of it.
Yeah.
I think is why we do it, isn't it? You know, ultimately what we want, a job at the end. So that's really nice that we've been able to see all of our students, you know, get a job, which is
no, that's great. Thanks, Danny. I think it'll be really interesting for our students to check out part 2 where we'll be able to speak to Laura, who's the apprentice and obviously coming to the end of her 3 years as well. And that'll give our students an insight into exactly what it is to be on that student journey through that process as well. So I just want to thank you really for today, for obviously talking to us about what happens or what goes on at Liverpool Women's, and obviously to I suppose, bring more information for our students around the role of the ODP, which I'm sure a lot of people will never have heard of before. So sounds like an absolutely fantastic role, great opportunity for our students to do a little bit more research on, certainly following the pre-work that they've done as well. So thanks very much for that today, Danny. Really appreciate your time. And students, if you want to head on over to part 2 now and listen to Laura, and she'll talk you through her journey. Thank you.
Thank you, Jill.